everyone, I'm Shiva. I'm a master's degree student at Federal University of ABC. The title of my presentation is a proposal for 3D electron-anatomical mapping software based on benchmark from current clinical systems. What is 3D electron-anatomical mapping and why does it matter for electrophysiological studies? By this kind of systems, we are able to create the anatomy of the chamber of interest, and we are able to identify atrial and ventricular arrhythmias, particularly complex arrhythmias such as atrial fibrillation and ventricular tachycardia, and it provides us precise localization of abnormal electrical activity. As we can see in this figure, we are able to look at the electrical activity at each point of region of the heart, and we are able to analyze them precisely to have a better treatment outcome for the patients. And the system is able to have the integration of heart geometry and electrophysiology for real-time guidance. There are other advantages as well. So 3D electron-anatomical mapping system provides us high-quality spatio-temporal data, which enables us better diagnosis and treatment outcomes. And it is able to integrate with other imaging modalities as well, such as MRI, as we can see in this figure, CT scan in this figure, and echocardiography. And with this kind of integration with different imaging modalities, we are able to create the anatomy of the chamber of interest with more accurate, with having more information and better outcomes. Mainly, there are four kind of electron-anatomical mapping systems from different brands that are being commercially used at hospitals and clinics nowadays. Insight from Abbott, Arrhythmia from Boston Scientific, CARTO from Biosense Webster, and ACQ Map from Acutus Medical. In this figure, I'm showing different types of diagnostic catheters. There are different sizes, different number of electrodes, and different characteristics that I'm going to explain more about each type later in next slides. In this slide, I'm talking about radio frequency cardiac ablation. So at hospital and clinics, they use RF generator, and they use RF ablation catheter type, which usually has 4-pole catheters, and the catheter by physicians enters to the femoral vein of the patient, and it reaches to the heart and chamber of interest, as we can see in this figure. So this is one specific type of diagnostic catheter, which is called circular catheter, and this is RF ablation catheter, which is located in the left atrium in this case. And here we can see in a closer view, and here as well we can see that when the ablation catheter started to ablate the specific region with which it creates the abnormal electrical activity in the heart. Now I'm going to talk about catheter localization technologies. So the first one, which is magnetic base. So how does this technology work? We should use a magnetic field frame under the table of the patient, and it produces 3 ultra-low magnetic fields between this value, which is detected by sensor in the tip of the catheter. And it is enable creating accurate 3D localization and reconstruction of cardiac chamber geometry. Another figure that we can see the same thing. So here we can see the magnetic field frame, and here in this figure we can see one type of catheter which has a magnetic sensor, so it makes a relation between the magnetic sensor and magnetic field frame to be able to create the anatomy for us. And it has more benefits than drawbacks. Now I'm talking about impedance-based technology. So this technology uses low amplitude AC current between surface patches and catheter electrodes and measure voltage differences to calculate impedance along 3 different axes. So the position is estimated by triangulating these impedance values, and but the problem of this technology is that it is affected by patient conductivity and movement, and because of that, the disadvantages are more than advantages. But nowadays, most of the systems use the combination of these two technologies for catheter localization, which is called hybrid. It is a mixture of magnetic and impedance field. In the left figure, we can see the magnetic field frame and patches, which is located on the body surface of the patient. This figure is from CARTO system, and the right figure is from Insight system. Again, it has magnetic field frame, it has patches, which is located in the body surface of the patient. Now I'm talking about my objective. My main objective is benchmark analysis, which is conducting a comparative review of commercial 3D electron-anatomical mapping systems to identify their key biomedical, computational, and clinical features with current electrophysiological practices. And specific objectives consist of catheter localization and tracking, signal pre-processing, mapping methodologies, and 3D anatomical modeling. So about methodology, I divided in 3 different sections: pre-processing, during the process, and post-processing of these 4 systems. About pre-processing, which is the same for all of the 3D electroanatomical mapping systems, they use the same procedure, but only the location of the patches might be different for each system, but generally they use the same procedure. Here, as we can see, all of the electrodes for ECG, we can see the patches which are located on the body surface of the patient. If the system has magnetic field technology, magnetic-based technology actually, we should also put the magnetic field frame under the table of the patient, which should be in the correct position as well. And all of the systems have 2 different modes: real-time or study mode and offline or review mode. So when we want to start a new study, we should use real-time or study mode because all of the connections of the patient should be correct and we should make a correct relation between the hardware part of the system and the software to be able to use the system. And for offline or review mode is just recording the data to use them for analysis later. And we need to enter patient information as well. So first name, surname, ID, the age of the patient, the physician's name and hospital's name, and the weight of the patient, which is the most important part if the system has magnetic localization technology, because it calculates the magnetic field according to the weight of the patient. Here, I'm talking about inside a system and different types of catheter that this system has. So there are 2 types of catheters here, HD Grid and HD Grid X, which they follow the contact mapping technique, and they use both magnetic and impedance field for creating the anatomy. And HD Grid X, which is the newest version of the HD Grid, they put one sensor at the tip of the catheter, which facilitates the procedure and would be easier and help the physicians to create the anatomy more precise and also faster. Here there is another type of catheter from this system, but it works with non-contact mapping technique because it doesn't need to touch the endocardium to create the anatomy, which is called non-contact mapping. And here we can see the ablation catheter type from the system. Here I'm talking about Carto system, so it has this kind of catheters, octaray, this type of catheter with different number of electrodes, and pentarray as well, but all of them work with contact mapping, and the system has also magnetic and impedance localization technologies. And here I'm showing ablation catheter, which is called Smart Touch. About arrhythmia, this system has this specific type of the catheter, which is called Orion. It has 64 electrodes. It also uses contact mapping technique, and it works with magnetic and impedance, which is called hybrid technology. And here I'm showing you the ablation catheter from this system. In this slide, I'm talking about ACQ-MAP, which has a specific catheter, because this system, the primary method which uses is non-contact ultrasound mapping, because the catheter from this system has 48 ultrasound transducers, and it is able to create the anatomy without contacting the tissue. But it has also patches which also uses impedance based as well. So there are 3 types of filtering for ECG signals: unipolar and bipolar electrograms for all of the systems. For notch filter, which is called noise reduction as well, for all of the systems are the same, 50 or 60 Hz, depends on the countries. And also high pass and low pass filterings are in these ranges, so for each system there are some differences between the values. Now during the process, so the first step that the physicians start to do during the process is using 10-pole or 20-pole catheter, putting in coronary sinus. As I'm showing you here, this is part of the coronary sinus in the heart. So when the catheter enters from inferior vena cava to the heart, so the physicians use fluoroscopy to be able to have a guidance to put the coronary sinus catheter in a correct position. But why they use this catheter? Because this catheter provides a stable and multi-site atrial and partially ventricular reference signal, which improves the accuracy of timing, activation, mapping, and pacing during the intracardiac electrophysiological studies. Here I'm showing you a video from Insight, as I've been doing an internship in one of the hospitals to have collaboration with physicians and see the whole procedure. This is during the process of creating the anatomy using HD Grid catheter from Insight, and we can see that the catheter is creating the anatomy of left atrium in this case. Here we can see that the left atrium anatomy was completed, so it's ready to analyze, and at the same time we can see the electrical signals of the heart as well. And here, in this video, I'm showing you when the physicians start to do the ablation. So because this case was atrial fibrillation case, the physicians started to isolate the pulmonary veins, which is the most common procedure for eliminating atrial fibrillation. Here about CARTO system, as I told you before, this system is able to integrate imaging modalities such as echocardiography that we are seeing here to create more precise and more accurate anatomy with giving more information to physicians to be able to have the best decision for the patient. Here I'm showing you from arrhythmia, so I'm showing you from the first step to the last step that this system uses to create the anatomy. And here it's the general window from the system, so we are able to look at the signals, look at the map, different types of mapping to be able to analyze the data. And here I'm showing you from ACQ map. So if you look in this figure from panels A to C, it shows the reconstruction of the left atrium anatomy using the ultrasound catheter, as I explained to you before. And green vectors are representing distances from 48 ultrasound transducers to the endocardial surface. And panel D illustrates the completed left atrium anatomy that we can use to do post-processing. About post-processing, which consists of 3D anatomical reconstruction, map rendering and color coding, interface tools, and editing. For insight, so when we complete the procedure of creating the anatomy using the catheter, after that we are able to edit the anatomy and separate each part, each region of the heart, and put a label for them to make them easier to compare and analyze the data for the physicians. Here we can see different types of mapping, which is like the result of the system. In the left side, we can see one example of local activation time mapping, and in the right figure, we are seeing one example of voltage mapping. In CARTO system is the same. We are able to edit the anatomy, make them smoother, and also we are able to create different types of mapping as well, including local activation time mapping to be able to identify the re-entries of the chamber of interest, and a voltage mapping to be able to identify scar tissues. Rhythmia as well. So we can see the different types of mapping in this system as well. In the left side, we can see the voltage mapping. In the right side, we can see the local activation time mapping, but it uses circular color coding because it shows the re-entry. So this system prefers to use circular color coding for showing re-entries. And here, this figure from ACQ map that it shows us the rotational activation, focal re-entries, and we are able to analyze and exactly see the region of abnormal electrical activity. So the part of my result, I can show you here from Insight. So about the signals, it is able to show 12 lead ECG, 10 bipolar coronary sinus catheter, 24 bipolar HT grid catheter signals, and 2 bipolar radio frequency catheter as well. So at the same time, you are able to see all of these channels. Another figure that I'm showing you to have a general overview about the software of the system. At the same time, we are able to see the signals, we are able to have dual view of the map, and also all of this information that helps the physicians to have complete information when they start to do the ablation. Here is one example that is part of my result. So I'm showing you one voltage mapping from atrial fibrillation case, and also this patient had atrial flutter as well. But you can see the color coding. The purple region shows the healthy tissue, and the colorful region shows transitional tissue, and the gray region shows scar tissue. Here another example of local activation timing from Insight, and you can see the color bar as well, the signals as well. Now I'm talking about arrhythmia. So we are able to see the signals from ECG, 10 bipolar coronary sinus catheter, 32 bipolar Orion catheter, which is one of the diagnostic catheter, and 2 bipolar ablation catheter. Here, this just an example to have some overview about the software of the system, and it is one example of atrial flutter case, which is part of the right atrium. In this video, you are seeing the voltage map from arrhythmia system, and here you can see the post-ablation of atrial fibrillation, which the physicians isolated all of the pulmonary veins to eliminate atrial fibrillation. And now I'm talking about ACQ map. system. Again, we can see 12 ECG signals, 10 bipolar coronary sinus catheter, 24 bipolar the specific catheter from this system, and 2 bipolar ablation catheter. And in this video, we are seeing the propagation mapping that this system has, and it shows us the electrical propagation inside of the left atrium in this case. And if I want to show you generally how number of bipolar channels do we need, I can say that we need 12 ECG channels, 10 bipolar coronary sinus catheter. If we want to use circular, or which is called lasso catheter, we need 10 bipolar channel for that, and 2 bipolar ablation catheter. So in total, we need to have at least 34 bipolar channels. So my project is still in progress, but I'm going to define the criteria for the core subsystem, aiming to ensure reproducibility in software implementation and to foster interdisciplinary collaboration among biomedical engineers, computer scientists, and electrophysiologists. So in the future, I'm going to conduct more comparative analysis between the existing commercial systems. I will finalize and validate subsystems and specifications. I will optimize software algorithms to enhance efficiency and stability, and I will integrate additional data sources to improve spatio-temporal resolution. This is my references, and thank you for your attention.